So when someone presents with acute pancreatitis in a hospital setting, very high triglycerides, consistent with familial chylomicronemia syndrome, is something that really should always be on the differential. Of course, there are other causes of pancreatitis, but that's something that doctors ought to consider. And then if they notice that the blood happens to be sort of creamy looking, that's often the trigger, the sign that this is a condition of FCS that really requires management of the triglycerides. There are other signs, sometimes in the eyes, a lipemia retinalis that can be a clue. But really, nowadays, it's the look of the blood and then ultimately the measurement of the triglycerides that really tips it off. Yeah, I mean, one of the exciting things about FCS is the new therapies that are in development. And it's really exciting. There's a therapy that targets a protein called ApoC3, and by inhibiting the production of that protein, actually data now show very clearly that patients with FCS have quite remarkable reductions in triglycerides. A recent study, large study, basically showed that there was a 77% reduction in triglycerides and suggested there was real reduction in pancreatitis. So that's one. There's another protein called ANGPTL3 that when you inhibit that, the data are suggesting that that may be another approach to treating FCS. So it's exciting times for treatment of this disorder. We're hoping that over the next few years, we're actually going to have new therapies that we can really use for our patients with this condition.